Stop everything, Africa. The earth is quaking beneath our feet and the epicenter is Burkina Faso, the land of upright people. In a move so bold, so earth-shattering, it has left the continent and the world speechless. Burkina Faso, under the indomitable leadership of Captain Ibrahim Traoré, has just pulled off a feat that will echo through history: the country's first ever successful kidney transplant. Hear me loud and clear. On Tuesday, July 29, 2025, at the Tengendogo University Hospital, CHU, in Ouagadougou, Burkina Faso, doctors, alongside Turkish medical experts, performed a medical miracle that has turned impossibility into reality. This isn't just a surgical triumph. It's a blazing middle finger to every African leader who has abandoned their people to die while chasing Western hospital beds. It's a thunderous rebuke to neo-colonial powers who thought Africa would forever kneel. And it's a radiant beacon of hope for every African dreaming of a future where their lives are valued, their talents unleashed, and their nations sovereign. Let me say it again, with the force of 1,000 drums, Burkina Faso has successfully completed its first kidney transplant. This is no minor headline. For decades, Burkina Faso citizens with end-stage renal disease, ESRD, faced a brutal choice: scrape together life savings for exorbitant treatment abroad or surrender to death's embrace. The average Burkinabe, surviving on less than $2 a day under the scorching Sahel sun, could only pray for a miracle. But Captain Ibrahim Traoré, a 37-year-old revolutionary whose name now reverberates like a battle cry across the continent, has delivered that miracle. As Dr. Robert Lucien Jean-Claude Cargougou, Burkina Faso's Minister of Health, declared during a press briefing on July 30, 2025, this historic breakthrough is the fruit of the unyielding vision of His Excellency Captain Ibrahim Traoré, who has made it his personal mission to save lives, rebuild our health system, and restore dignity to our people. This is a moment to stand still and marvel. Burkina Faso, a nation once shackled by underfunded hospitals, colonial exploitation and systemic neglect, is now performing kidney transplants. Just 3 years ago, patients with kidney failure were airlifted to Turkey, India or Europe, if they could afford it, while others perished in despair. Rural mothers lost children to treatable illnesses because the nearest clinic was a distant dream. Today, under Traoré's fearless leadership, Burkina Faso is not just surviving, it's soaring, daring to dream bigger than ever before. This is a revolution, brothers and sisters, and it's sending shockwaves across Africa, exposing the failures of corrupt leaders and challenging the West's stranglehold on our continent's destiny. Captain Ibrahim Traoré is no ordinary leader. He's a liberator, a modern-day Thomas Sankara, whose every action screams, Africa for Africans. Since seizing power in a coup on September 30, 2022, Traoré has waged a relentless war against the injustices that have crippled Burkina Faso's healthcare system. When he took the helm, the situation was nothing short of catastrophic. Hospitals were crumbling relics of colonial neglect, understaffed, under-equipped, and riddled with corruption. Patients with chronic illnesses like kidney failure faced hospital bills that could bankrupt entire communities. A single dialysis session could cost a family their land, their livestock, or their future. In rural areas where 70% of Burkina Faso live, access to emergency care was a fantasy. The elite, meanwhile, jetted off to Paris, London, or Dubai for treatment, leaving ordinary citizens to die in agony. Traoré looked at this betrayal and roared, "No more!" His first act was to slash hospital bills, making healthcare a right, not a privilege. Dialysis, once a death sentence for the poor, is now heavily subsidized by the state. Chemotherapy, previously reserved for the wealthy, is within reach for ordinary Burkina Faso. In 2023, Traoré's government introduced a universal healthcare subsidy program, ensuring that no citizen chooses between food and medicine. This alone is revolutionary in a continent where healthcare is often a luxury for the elite, leaving the masses to suffer in silence. But affordability is only half the battle. Traoré knew that healthcare must reach every corner of Burkina Faso, especially the rural heartlands. In a move that stunned skeptics, he launched mobile hospitals, state-of-the-art medical units that roam the Sahel, bringing life-saving care to remote villages. These aren't just ambulances, they're walking hospitals, equipped with diagnostic tools, surgical suites, and emergency response teams. Picture a grandmother in a northern village, struck by a sudden illness, now treated on the spot by a mobile hospital. Imagine a child saved from malaria because a medical team arrived in time. These units have slashed rural mortality rates by 20% in 2024 alone, according to the Ministry of Health. They're a lifeline for the forgotten, proving that no Burkinabe is too remote to deserve care. Mobile hospitals are just the beginning of Traoré's audacious vision. He's not content with stopgap measures. He's building a healthcare empire to rival the West. In February 2025, he unveiled plans for 55 modern hospitals across Burkina Faso, a project so ambitious it silenced critics and ignited hope nationwide. These aren't makeshift clinics. They're cutting-edge facilities with MRI machines, intensive care units, and specialized departments for cardiology, oncology, and organ transplantation. The crown jewel is the 500-bed National Hospital under construction in Ouagadougou, set to be one of West Africa's largest and most advanced medical centers by its completion in 2026. This hospital will serve not only Burkina Faso, but also patients from Mali, Niger and beyond, positioning Burkina Faso as a regional hub for medical excellence. The kidney transplant at Tengendogo University Hospital is a glimpse of this future. Performed by Burkinabe doctors trained in Turkey with support from Turkish experts, the operation was a masterclass in skill and collaboration. Dr. Eyüp Kaveci, president of the Turkish Organ Transplant Foundation, announced that the project aims to establish a sustainable kidney transplant program in Burkina Faso, with the first 10 operations fully funded by the government. This is sovereignty in action. Burkinabe doctors performing world-class procedures, reducing dependency on foreign hospitals. The era of airlifting patients to Europe is over, and Traoré is the architect of this transformation. These hospitals are more than buildings. They're symbols of defiance. For too long, African nations have been forced to rely on Western medical systems, with elites flying abroad while ordinary citizens languish. Traoré has rejected this dependency, building a healthcare system that rivals those in London or Paris. The kidney transplant is proof that Africa can master complex procedures without begging for Western approval. It's a declaration that Burkinabe lives matter, and that African talent, when nurtured, can shine brighter than any imported expertise. Traoré's brilliance lies in his holistic approach. He knows that hospitals, no matter how advanced, are useless if people can't reach them. In a country where rural roads were once little more than dirt tracks, he has launched an infrastructure revolution, building 3,000 to 5,000 kilometers of roads annually. These roads are not just pathways, they're lifelines connecting remote villages to hospitals, schools and markets. A pregnant woman in labor can now reach a hospital in hours, not days. A farmer injured in the fields can be rushed to a mobile hospital or regional center. In 2024, these roads connected over 300 villages to the national grid, reducing maternal mortality by 15% and child mortality by 12%, according to UNICEF data. These roads are transforming Burkina Faso's economy as well. Farmers can transport crops to markets, earning enough to afford medical care. Traders can move goods without fear of getting stuck in mud. Children can attend schools near hospitals, ensuring they grow up healthy and educated. This is what leadership looks like. Not empty promises, but tangible results that touch every life, from the bustling streets of Ouagadougou to the quiet villages of the Sahel. Traoré's revolution is not just about saving lives. It's about building a future for Burkina Faso's youth. His healthcare and infrastructure projects have created tens of thousands of jobs for young Burkinabe, from doctors and nurses to engineers, road workers and hospital administrators. The kidney transplant team at Tengendogo included young Burkinabe surgeons trained in Turkey and mentored by Turkish experts. Traoré's investment in education has sent hundreds of students to study medicine, engineering and technology abroad, with a mandate to return and serve their nation. In July, Traoré made global headlines by donating his own blood, urging citizens to join him in saving lives. This wasn't a publicity stunt. It was a call to action from a leader who lives his values. Where else in Africa have you seen a president roll up his sleeve to give blood for his people? This act inspired thousands of young Burkinabe to volunteer at blood drives,